Right now, somewhere in a college library, a 19-year-old is highlighting a biology textbook. They have already decided they're going to medical school. In their head, the picture is simple. 4 years of school, a white coat, a six-figure salary, and a life that finally feels secure. But here's what almost nobody tells them before they sign away the next decade of their life. The real reason people regret medical school is not the school itself. It is everything they never calculated before they applied. You have probably heard the warning before, do not go to medical school. It sounds dramatic. It sounds like something a bitter doctor says at 2 in the morning after a 16-hour shift. But the warning is not really about medicine, it is about math. Here is the math nobody puts in the recruitment brochure. 4 years of undergrad, 4 years of medical school, then 3 to 7 more years of residency, depending on the specialty you choose. That is 11 to 15 years between the day you start preparing and the day you are finally a fully licensed, fully paid attending physician. 11 to 15 years. Think about that for a second. Your friends in other careers spend those same years getting promoted, buying houses, building savings. You spend them studying, training, and earning a fraction of what you will eventually make. And the debt waiting for you at the end of that road is not small. According to the Association of American Medical Colleges, the average medical school graduate in the class of 2025 left school with roughly $220,000 in education debt. Add in undergraduate loans, and the real total climbs closer to $240,000. That number is before interest. That number is before residency. When you are working brutally long weeks for a stipend, the AAMC reports average under $70,000 in the first year, less than what some hospitals pay an experienced nurse. And you are doing it with a medical degree already in hand. So why does anyone choose this path? Here's the twist most videos about medical school skip entirely. The mistake is not medical school. The mistake is going for the wrong reason. People who chase medicine for prestige, for the title, for the word doctor attached to their name, hit a wall almost every time, because once you are inside the system, prestige does not pay down $200,000 in loans. Prestige does not get you through a 3 a.m. shift in a packed emergency department. And prestige does not fix the thing the American Medical Association keeps measuring year after year: burnout. The AMA's most recent national survey found that nearly 42% of physicians reported at least one symptom of burnout in 2025. That number has actually been falling for 3 years in a row, which sounds like good news. But look closer. In emergency medicine, the rate still climbs close to 50%. In oncology and obstetrics, it is not far behind. Picture 10 emergency physicians standing in a room. Statistically, 5 of them would tell you honestly that they are running on empty, and the debt itself is not evenly distributed either. AMC data shows graduates of private medical schools carry noticeably more debt than graduates of public ones, often tens of thousands of dollars more for what is on paper the same degree. Meanwhile, the Bureau of Labor Statistics keeps projecting steady demand for physicians for years to come. Alongside rising demand for physician assistants and nurse practitioners, roles that take a fraction of the time and a fraction of the debt to reach, which raises an uncomfortable question nobody asks out loud during the application process. If the healthcare system needs more workers and there are faster, cheaper paths into healthcare that still pay well and carry real responsibility, why does anyone still choose the 11 to 15-year road? So is medicine a trap? Here is where it gets complicated. Despite the debt, despite the hours, despite the burnout numbers that make headlines every single year, something strange keeps showing up in the data. When Medscape surveys physicians about their actual day-to-day work, most still report real job satisfaction, not because the system is gentle with them, it often is not, but because the work itself, sitting with a person who is scared and in pain and actually helping them, still means something a paycheck alone could never replicate. So, which is true? Is medical school the worst financial decision a smart person can make? Or is it the most meaningful career path most people will ever have access to? The answer is both. And that contradiction is exactly why so many people get this decision wrong. They imagine medicine as a destination, a title you simply arrive at one day. But medicine is not a destination. It is 11 to 15 years of slowly becoming someone under enormous pressure while the rest of your life waits on the sidelines. Your 20s move differently. Your friends outside of medicine reach milestones years before you do. Even your own body adjusts to a kind of exhaustion most careers never ask of you. If you walk in expecting comfort early, you will be disappointed. If you walk in expecting the title alone to carry you through the hardest nights on the floor, you will be disappointed. But here's the part almost nobody says out loud. The physicians who actually thrive are not the ones who ignored the cost. They are the ones who calculated it completely, in dollars, in years, in missed birthdays, and canceled vacations, and decided with full clarity that it was still worth paying. That single difference, calculating the cost honestly versus ignoring it, is the real line between the doctors who burn out and the ones who do not. This is not unique to medicine either. It is true of every certification, every licensing exam, every overnight shift in any healthcare role. A certified nursing assistant who understands exactly why they chose the work tends to outlast the one who only wanted the paycheck. A respiratory therapist who knows what they signed up for handles a brutal ICU rotation differently than someone who did not. The job is identical, the outcome is not. What separates them is never the difficulty of the work. It is whether the person walked in with their eyes open. So if you are standing exactly where that 19-year-old in the library is standing right now, highlighting the same textbook, picturing the same white coat, the real question is not, should I go to medical school? And the real question is this: do you understand exactly what the next 11 to 15 years will cost you in money, in time, in sleep, in the version of your 20s you will not get back? And are you choosing it anyway with your eyes fully open? You do not need to be in medicine for this to apply to you. Maybe the path in front of you is not a residency. Maybe it is a certification exam, a return to school later in life, a promotion that demands more hours than anyone admits up front. The shape changes, the underlying choice does not. Every meaningful path asks for payment before it offers a reward, and the only real failure is agreeing to pay without ever counting the costs. Because the mistake was never medical school, the mistake was always walking in blind.